Okay. Hello, welcome to Pharmville. Quick disclaimer. My friends Vivian and Anna are sitting with me. They'll be asking questions, hopefully. And this is to help trigger memories of the information that you need to know. It's not exhaustive, and it's none of the physiology because it's kind of implied in these that you'll have memory triggers from the physiology to be like, oh, it's this, wait, I remember this, so I know it's a CNS depressant. And then from your studying of physiology, you should know what a CNS depressant does. So it has that assumption. Okay, this is Pharmville so far. It's incomplete, it's in progress. We love Pharmville. Okay, welcome to Sleep District. We're gonna start with the infamous tamimazepam. Whoa, Tammy causes some trouble. I think that's all we need for Tammy. Okay, Tammy has a midnight market is what she calls it, but that's kind of just a fun name. You don't really need to know anything with that. And she sells mattresses that she laces with benzodiazepines, which is just like a little crazy, a little kooky. But there's this one guy who complained to the newspaper saying like, I don't think she actually laces her mattresses with benzodiazepines. I think that she just does a little like voodoo, impresses the spine of her customers, and that's how they fall asleep when they try the beds, and everybody's convinced. And that's a little silly, and we know why that's silly because that's just how benzodiazepine works. It suppresses the CNS activity, which is great if you want to go to sleep. Not great if you don't want to go to sleep. She's in Sleep District. We have a warning on the front of the store, and it essentially is just warning you that her mattresses don't go with opioid poppy decor. She has really strong feelings about that because black box warning, no opioid use with the benzodiazepines. Tammy really doesn't like them. And you actually do get withdrawals with her mattresses, which is a little bit weird because they're mattresses. I don't know. I wasn't very creative at this point. It gets better, trust. Tammy started a lot of drama around town. She has 2 customers that she banned from her store, and most people just like ban them from her store, but they're like fully wanted. It's Narrow Angle Gloria and Prego Debo. It's category D with pregnancy. Don't take it if you're pregnant. Scandal going around town. Everybody's so worried because all of Tammy Mazepam's Vivian, be serious. This is a serious topic. All of Tammy's customers, you can actually laugh. It's fine. The people know you're there. Anyway, scandal. Tammy Mazepam's customers going crazy, wreaking havoc. There are so many of them doing weird things. Like this is excited Evie, and she has squiggly arms. She's just overly excited and nervous all at the same time. That's an adverse effect, being paradoxically excited or nervous, I guess. This is Shivering Sam, and he shivers, and nobody really knows why. This is Tornado Terry. He's really dizzy. And it's really obvious because he looks like a tornado. This is Hangover Harry. Hangover Harry not only has a hangover in the mornings, always, after using Tammy Mazepam's mattress, but he also has a headache, and he has cognitive impairment, and he's sleepy in the mornings, all because of his hangover. So I think we just knocked out multiple adverse effects in one side character. Great. Okay. Let's see. Oh, yeah. Tammy Mazepam trashed this little girl's grapefruit stand. You can see her over here. She's all cute and excited, but Tammy Mazepam, it just, like, goes crazy. There's something going on there. I don't really know what it is, but the newspaper is obsessed with it, and she trashed the grapefruit stand of this cute little girl, and everybody's really sad. you can't have grapefruit when you're taking benzodiazepines because it's an interaction. What else about tamimazepam? Yes. This guy said, I finally slept when asked for a quote by the newspaper. And this person said, who said alcohol withdrawals are so bad? Just sleep on this mattress. Because an alternate indication other than insomnia is to lessen withdrawal symptoms from alcoholism or alcohol use disorder, as we like to call it. This person gave tamimazepam's mattress 1 star, oof, because it took 30 minutes to an hour to be seen at her store. That's kind of a long time. Activation time, 30 minutes to 1 hour. Kind of a long time to wait to be seen. And she claimed it's unacceptable. Even if there really was a confused customer with 1+ reflex responses entering a coma, that's a long time to wait. So this is just an antsy customer really complaining about silly things, but like this other customer that was like 1+ reflexes, diminished reflexes, and really confusion, and entering a coma, toxicity and overdose symptoms of benzodiazepines, that happens in tamimazepam's store all the time. This is a common review, actually, unfortunate. And then, oh yes, this is the guy who thought that she was just doing weird, like, acupuncture stuff, I guess, on the spines of her customers, which, like, this claim is kind of baseless, but point being, a lot of people have beef with her. People don't use her mattresses as a first resort in this town when they need sleep, i.e., benzodiazepines are not a first-line drug for sleep problems because they have so many things going on. Nobody wants to mess with tamimazepam, and they shouldn't. This is Dr. Suvor. He is a doctor. This is Suvorexant, by the way. And his store is open 7 to 7. Really great. 12-hour action. Fantastic. And his slogan is Black Potions Block Orexin. And he sells potions. He's not a real doctor, but nobody knows that. And, he got this, like, really weird comment from somebody in the newspaper, and it says, Block Orexin? More like make zombies, because all of his customers spontaneously throughout the night when they're supposed to be asleep just start having nighttime behaviors, and then when they're awake in the morning, they're all zombie-like with a hangover and tired and like, because Suvorexant also causes those things. Anyway, next, I'm actually going to save Dream Depot for last because I'm personally attached to the little story there. Next is, let's do Zolly Ambien next. This is Zolpidem, and the brand name is Ambien, which is why it's Zolly Ambien, but she has a dream design studio. She, it's also Sleep Drug, Sleep District, still in Sleep District. Keep up. Okay, the coupon is a 2-for-1 deal with code Ambien CR SR, because Ambien CR is the sustained release form of the drug. I didn't know what CR meant in the drug name, so I added SR because I know what SR means. So the coupon code for 2-for-1 is Ambien CRSR. Just a funky little code to make sure nobody guesses it on accident, I guess. And it's 2-for-1 because Ambien CR, the sustained release version that has a longer action period, has 2 drug reservoirs that both work in tandem. I think I was just being silly when I added that. That doesn't actually have anything to do with this drug. Zolly Ambien, rival of Tammy. More Tammy drama. Oh my gosh. Tammy makes some rivals and some enemies here. I can't make this stuff up. I can't. I truly can't. So this is to remind you that Zolly is a non-benzodiazepine. That's really it. she just doesn't like Tammy at all. Then this anonymous response person, anonymous person with a quote in the newspaper, said they should call her customers Zolly Zombies. Because guess what? Also nighttime behaviors, adverse effect. Highlight. And then at least she doesn't align with Tammy's benzo behavior, i.e. bozo behavior. Because Tammy's being a bozo. But she's a benzodiazepine. So y'all are quiet. I don't like that. Please don't be quiet. You're absorbing it? Yes. Okay, good. I'm glad. Y'all can, like, stop me or, like, say something. Okay. She also... No, that's not Zolly. That's Kava. It's coming later. I had a thought, but it was the wrong thought. Zolly, in theory, has an alliance with Esme, and the newspaper's really confused about this. They're like, do they have an alliance? We're not really sure. Nobody really knows. It's kind of just a theory, but we think it might be like under the table because Esme and Zolly are very, very different. Esme has a spa and she's not very dramatic. She doesn't really have any drama going on. Everybody really loves her. So it's kind of like an under the table shaking of hands. They're both against Tammy, but Esme also just doesn't really want to be associated with Zolly. They're so different, even though they're both non-benzodiazepines. Neither of them associate with Tammy, but they're still pretty different. Esme Zopics, don't tell me. Ezopiclone. Ezopiclone. She has a spa. It's open 9 to 5, aka 8-hour duration. And her slogan is beautifully, safely, soundly. Esme Zopic. Zopic. Anyway, beautifully, safely, soundly, because it is safe for long-term use. Fantastic. There's no adverse effects that we need to know for our exam at our school with our professor. I don't know who else is watching this. I don't think anybody else is watching this, but we don't need to know any adverse effects with this one. She says, a customer says, I've been coming here for years. Love Ezopiclone. Approved for long-term use. And then another one says, always seen right away. Esme is my pick. That's to cue to Ezopiclone, in case you forget the name. And also, they're always seen right away. Everybody's so happy with Esme, unlike Tammy. But everybody's so happy with Esme because you get seen right away, immediate action. So once you take that, John, you're asleep. Oh my gosh. This is Sister Rameltion's Chapel of Rest. Because... Sister Rameltion is watching all this drama happen in the town, and she's like, guys, if you just, as her quote says, assisted your body's natural mechanisms, I think she says, yes, your body's natural mechanisms, everything is going to be so much better. We actually don't need to know any interactions or adverse effects for this drug, so a chapel is a very peaceful place to be. But what we do need to know is that the chapel, like every chapel and every church should be like this, it's always open, always unlocked. So Rameltion is not a controlled substance. Rameltion is not a controlled substance. Immediately, what are you thinking?
No, that's really good.
Wait, okay, perfect. Wait, is there something I'm missing with that tagline? Because I know I think it's two things. One is that it's not a controlled substance. What's the other one?
Just like the mechanism of...
Oh, yes. Enhance your body's natural mechanisms. Because your body already releases melatonin for sleep onset. The indication for this drug is specifically sleep onset. And because... it enhances the binding of melatonin. So her whole thing is enhance your own body's mechanisms. She's very peaceful. She loves the human body because the Lord created it, as she should. Yeah. But anyway, that's to help you remember that it assists melatonin binding. It's a melatonin agonist. Oh, let's go to Kava. Kava Kai's calming tea. She wanted to be funky and use calming with a K. Because why not? And really, that was me. So I'm going to do my favorite part last. I came up with this part last night. I'm going to do that one last. But she is kind of hippie-ish, as you can see by the peace sign. She sells tea. She's an herb. She sells tea. She's an herb. She's a little hippie-ish, right? Okay, so she lets people use her storefront as a space to protest, to get Sleep District to be a dry county again. She does not like alcohol use. She hates liver disease. Don't give Kava, the herb, to somebody with liver disease. There's hepatotoxicity to be concerned about here. It should not be mixed with alcohol. As you should know, most sleep drugs, because most of them are CNS depressants, you should not be giving them with other CNS depressants. That's kind of implied when we talk about CNS depressant and benzodiazepines with tamimazepam. That's a sidebar. Kava Kai's calming tea. Kava, the herb. No known mode of action, but definitely don't give her to somebody with liver disease. One of the contraindications is, I think it's alcohol use and liver disease. Yes. Okay, perfect. So that's important. And then people think that Kava and Tammy are in an alliance. Well, it wouldn't surprise me because Kava clearly loves the drama if she's like very passionate about picketing for being a dry county. She loves the drama. So she's in on it with Tammy. She was seen stating that brat at the grapefruit stand had it coming. She also doesn't like grapefruit. You should not take Kava and eat grapefruit. It's not gonna end well. And then Tammy says, she steals from my store, which is why everybody's a little bit confused. Like, they seem to be agreeing, but they're not. Kava's an herb, not a benzodiazepine, but they're in an alliance. And everybody thinks that they're in an alliance because they have the same adverse effects, the same indications. Wait. No. The indications are the same for valerian, but they have the same adverse effects. So people think that they're very similar. An anonymous comment was, her teas, quote unquote, are nearly identical impacts as Tammy's mattresses. How does that happen? I don't know. I kind of just threw that comment in to like solidify the memory that they have the same impact, but that one wasn't very creative. This is my favorite part. If you zoom in to this TV, perchance you might find the remaining adverse effect, in addition to the benzodiazepine adverse effects. She's watching the Lorax on her TV inside of her store, and this is the part in the song Let It Grow where they say, our son Wesley kind of close, la 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 la, etc. Because Kava could result in temporary yellowing of the skin, and you look like you kind of glow. Anyway, that's my favorite part. Next we're going to talk about Val, because they're very similar. Valerian is the name of the herb. This is Valeria's. That's it. It's just called Valeria's. And her slogan is dose with devotion, because she's a little bit more dangerous than Kava, if we're being really honest. She does this weird thing where she also bans customers like Tammy. She's also very similar to Tammy in that way. She really doesn't like Maui from Moana, the MAOIs that are antidepressants. Don't mix them with valerian. She also doesn't like guns, no war. I'm a pacifist, okay? She's also a little hippie-ish. That's how you remember that she's an herb. And she's a pacifist. She really doesn't want war, really, is the problem. Warfarin, interaction, no warfarin. That one got Anna, that's funny. This one also, like, I made this one up. I previously just had phenytoin written there, but I made this up at like 9:30 last night. Phineas from Phineas and Ferb.
Why, you drew fur.
Shoot!
I was like trying.
Ferbatoin, yes. Phenytoin, I drew Ferb on it. I'll fix that later. Phineas Towen. She hates Phineas and Ferb. Clearly, she messed up their names. The other thing is, like, this, and this person comments on it to the newspaper, but, they're like, wait, hold on. One's just she's just copying Kavakai. She's totally in on it with Tammy too, is an anonymous comment. Again, very similar adverse effects to the benzodiazepines. Great. Less remembering things for us. Here's some reviews. I lost weight too! Yay! Adverse effect, anorexia. Not good. 1 star, didn't work. Fun fact, a good chunk of the additional adverse effects, in addition to the ones that are very similar to the benzodiazepines, are restlessness, insomnia, and anxiety, which are also the 3 indications for this herb. Weird. But that's why this guy said it didn't work. Because for some people, it does the opposite. Idiosyncratic or adverse effect. You decide. The jarred organs made me nauseous. Nausea, and I believe vomiting as well, is also an adverse effect in addition to the benzodiazepine adverse effect. And they commented on the jarred organs because there are 3 jarred organs that she puts on display in her store. Really weird. The heart, the kidney, and the liver. I didn't want to draw an accurate heart. Sorry. But if you have cardiac disease, renal disease, or liver disease, don't take valerian. Bad. Bad. Don't do it. Okay, I think that's all for Val. Next, we're gonna come over here to Dream Depot. Dream Depot, the kind of idea here is think over the counter. Think easy access. Because it's just like Home Depot. You walk in and even I, somebody who doesn't build anything ever, can just walk in and buy a 2x4. Or a nail gun. Weird. Dream Depot. Anyone can get these. This is, they have a special section here. It's called Doxy and Diaphan's Picks. And these are 2 YouTube sisters. They're twins. They got famous on YouTube, and these are their picks for Dream Depot. Dream Depot sells dreams. So they did this trendy little video idea where they tried a bunch of kind of funky nightmares and filmed their reactions to them afterwards. LOL. They're famous for their blurry camera aesthetic. You might get blurred vision after taking these. Dream Depot's slogan is sleep today, forget tomorrow. 'Cause an adverse effect is dementia. Now, the dreams that they tried are over here in their viral videos. It's in the nightmare section, famous from their Dare to Dream video. Okay, one of them is dry mouth when you're about to give a speech. Ooh, nobody wants that. That was funny. Dry mouth is an adverse effect. Ex-boyfriend rebounds with your BFF. I'm dead. Well, that's not an adverse effect. Don't worry. I just say that as a phrase sometimes. Rebound insomnia, adverse effect. Also tolerance. That's to remind you of tolerance too, because why did you tolerate him? Why? Anyway, next one is hangover while kids are throwing tantrums. Morning hangover, man. What can I say? Oh, wait. Tantrums? Seizures? Is there something about seizures with these? No. No. Fall risk. Okay, I'm pretty sure this is in our cute little review here. I watch their videos while I wait for you know what. Ha ha ha. He's saying that he watches their videos while he waits to have a bowel movement, aka he's constipated, and that's an adverse effect of these drugs. Fall risk is also one. I don't think I put it in here, but because I think in my head I was like, sleep drugs, all of them are a fall risk because they make you sleepy. So I think that that's why I didn't put it in there. I think on a select all to apply, we would all be like, oh yeah, duh, fall risk. They're gonna be sleepy. Hello. That's Sleep District, everybody. Now you know all of the sleep drugs. Nice. All their indications are for some kind of insomnia. They calm you down. So kava is also used for anxiety and restlessness. That's why it's called kava's calming tea. Kava Kai's calming tea. Things like that. Just to clue you in, wrap things together. You can add to it. You can zhuzh it. You can change it if that helps you more. I don't know. Okay. Next is itis district. There's not much going on in itis district at any given point in time because the glucocorticoids, they're for anything that ends in itis, any kind of inflammation ever. That's what glucocorticoids are for. They behave exactly like cortisol because they're a synthetic form of exogenous cortisol. And if you studied your pathophysiology part of PathoPharm, then you know everything about cortisol that it does and the effects that it has on your body. So there you go. You have your indications, what it does that's good, and you also have your adverse effects, what cortisol does long-term that's not so good. So I didn't include those, but I did include a slogan for itis district. So sorry if you read ahead. It says, where the red, hot, and plump come to leave, and the sad, sickly, and fat come to get stomach ulcers. To help you remember some of the inflammation indications and some of the main adverse effects. It's bad. Anyway, the glucocorticoids had a poetry workshop. It was alliteration night because other than the indications and the adverse effects, not much that you need to know about the glucocorticoids. Great for us, except the different routes that they could be. What's most appropriate for each form of glucocorticoid. So we have things like hydrocortisone hands-on. Alliteration, nice. That's a intradermal topical form of intradermal lotion. So like topical administration form of drug. Triamcinolone, don't know if I'm saying that right, but triamcinolone topical touch, also a topical drug, used as a lotion. And then also I didn't put specific indications for the different routes because I also feel like those are kind of logical. Like a lotion is going to be for a skin related form of inflammation. Like eczema. Thank you. Like eczema, things like that. Prednisone pill popper. That's PO if you couldn't tell. Prednisone is PO. I feel like I could have looked at that, but prednisone pill popper is more peppy, I guess. Okay. Fludrocortisone floats down with a glass of water. Also PO. Less peppy. And then methylprednisolone. Methylprednisolone.
Yes, you got it.
Makes a mark. That's going to be with a needle in an IV or some kind of injection. It can be IM, IV push, things like that. Parenteral. Here are some contraindications, some cautions, if you will, for the glucocorticoids. Potassium pal, also alliteration. We love potassium. If it's not a potassium sparing diuretic, don't take it. Non-potassium sparing diuretics, bad. Halt hypoglycemia. If your patient is on anti-diabetic drugs that make them hypoglycemic, halt hypoglycemia. Don't do it, because cortisol and glucocorticoids increase your blood glucose, and they will reverse the effects of that drug that patient is relying on. So halt on hypoglycemia. Immunizing idiot. Don't take glucocorticoids when you have some sort of immunizing biologic, so vaccines, things like that. The glucocorticoids held a poetry workshop, and somebody said, I think they need more than just a workshop, because they're still not very good. That was just to make me giggle, no real purpose there. Okay, next, one of my personal favorites, North-itis District. Wow, we love North-itis District. NSAID. What else is for inflammation? What else is for the blank-itises? NSAIDs. North. This is how you separate them. Great. Okay, so it's north, so I kind of drew it like a North Pole sign, which is kind of fun. And that ties in later. This guy's my favorite. We'll talk about him at the end. But this is kind of just like the rundown of what you'll find in North-itis District. They're known for being chill. There's not much drama going on in NSAT in North-itis District. They're all pretty similar. Not much drama. What was I saying? Oh, they only have beef with one thing, and that's posting Glendin. They all block prostaglandin synthesis, but please don't post Glendin. He's a beloved townsman here. He calls everyone he knows very frequently, so very relational guy, i.e. prostaglandin is a mediator, calls all the people needed for inflammation, which is good to know. Calls you to mind for that pathophysiology piece. Yes. Oh, he doesn't like being photographed. That's it. That's just for you to remember posting Glendin, prostaglandin. Anyway, warning! There's one weird thing. There's actually two weird things about North-itis District. Black box warning. Clot cult. There's a cult in North-itis District. Don't go near them. They're called clot cult because there is a black box warning for MI and other disease processes that are caused by a clot where we don't want them, which is kind of ironic because most of these are blood thinners. All of them are blood thinners, actually, especially aspirin. But it's unexpected, but it's there because North-itis District is usually really chill, other than this like one thing. So unexpected, but it's there. We don't really know why blood thinners would cause clots in unwelcome places, but it's there. Next, it's in yellow so you don't forget, but it's so cold in North-itis District that your pee freezes. Don't take these drugs if you have any kind of renal failure. It's never toxic. Anything to do with peeing, not a good idea. Your kidneys, not happy in North-itis District. So sorry. Okay, we're going to start over here with the pad. The pad is one of my favorites. Oh, wait, that's the wrong. This is the pad. The pad is one of my favorites. Cute little story. Professor Ibuprofen, and Roxanne, aka Naproxen, They're married. They met at the pad, PAD. But don't tell me. It's something acid derivative.
Yes.
Propionic acid derivative. The pad. They're both propionic acid derivatives. Their relationship was derived at the pad. Okay? Okay? We got this. We're going to get through it together. Okay. Professor ibuprofen, Roxanne, aka naproxen, met here. Technically, Professor Ibu, he knows more people because of all of his students. But Roxanne actually worked as a camp counselor where they gave you camp names. That's why her camp name is Nap. Cute, of course. And so because she worked at camp, she actually has better relational bandwidth, even though ibuprofen is used more often than naproxen. Naproxen has a better adverse effects profile than ibuprofen. For our class, that's really all you need to know when you compare the two. So naproxen, less adverse effects, but ibuprofen used most frequently. It's the most frequent NSAID that you'll see. Yep, that's all you need to know for propionic acid derivatives because all the things for all the NSAIDs apply for all the NSAIDs except for aspirin, but we'll get there. This is the AAD gym, and this is Kita. She's a troublemaker. AAD stands for acetic acid derivative, and it's a gym because acetic acid is what your body makes when it goes anaerobic during exercise. Acetic acid derivative. We're thinking big now, guys. Okay, so Kita, ketorolac. Ketorolac, really is used most often as an analgesic, but it is technically an NSAID. It has strong analgesic effects, but it is an NSAID. So why is it not in the analgesics? Well, Kita doesn't really belong here. She actually sneaks past the desk at the gym. She doesn't have a membership, but she's a gym rat. So she's an NSAID, but she's used most frequently as an analgesic. She doesn't really belong here, but she does. So she sneaks past the desk to go to the gym. She overworks herself, so she frequently gets acid reflux and nausea from overworking her body. We all know somebody who's been there. Those are two adverse effects of ketorolac that are specific to ketorolac. She's nervous about being found out, so she avoids going to the locker room. She just holds her pee and the need to void and all bowel movements while she's at the gym. But we also know that she overworks herself. She's there for a really long time, and she's not peeing. She's not going to the bathroom. Constipation, nephrotoxicity. Bad. Ketorolac. Kita. She's not taking care of her kidneys. She's not going to the bathroom. Problem. That's Kita.
Wait, there's one thing.
Wait, what?
Her 5-day warning.
Oh my gosh, I forgot to write this down. You're so right. So Kita's sneaking past the desk. She's gonna get found out eventually, right? She just looks sus. She knows it. She knows it's coming. She looks sus. Guys, they found her out within 5 days of her starting this adventure. She is contraindicated for use beyond 5 days. Don't use ketorolac for more than 5 days. Bad. Did you tell your friend about this? Does she know about this? Your friend that was prescribed ketorolac?
Yeah.
Okay, good. I'm just making sure. Doing my due diligence. This is Celebrex. Let's celebrate. You know Party City? Basically Celebrex. Celebrex. Let's celebrate! You know why we're celebrating? We're celebrating because only COX-2 is being blocked. We love COX-1. This is patho-pharm knowledge. COX-1, we love COX-1. It's thrombosin. It makes thrombosin, which is for clotting. We love clotting, and it also makes prostaglandin I2, because I want prostaglandin I2, which is good for your stomach lining, things like that, which is great. So we're preserving COX-1, which is good, but we're blocking COX-2, which is involved in prostaglandin E2, which is an inflammatory response specifically. So all the other NSAIDs are contraindicated for peptic ulcer disease because of their adverse effect of causing stomach ulcers and stomach pain, things like that, because they destroy the stomach lining they destroy GI mucosa production because of blocking prostaglandin I2, etc. Those are all patho things that should have been cued when we talked about prostaglandin, is kind of the idea with where I'm going with Pharmville, to explain further. Shelley Cox, so celecoxib. Am I saying that right?
Yeah.
Celecoxib?
Yeah.
Okay, celecoxib. So Celebrex is technically the brand name, but it was also just a good name for like a party store, so I kept it. Celecoxib, Shelley Cox. Shelley Cox is celecoxib. Okay, Celecox is party store. Her specialty? Parties for people who don't need a GI specialist anymore. And you know what? I'm pumped because I'm still seeing a GI specialist and I'm kind of over it. And I would really love a party after this is over. So that's where I got that. Yeah, that's just to help you remember that it preserves COX-1, and COX-1 is good because it preserves your, it makes prostaglandin I2, which is good for your GI mucosa, which means that Celebrex, aka celecoxib, which is the generic name that you need to know for the exam in our class, it does not share the adverse effect of stomach ulcers. It's gentler on your stomach. Good option for that. This, guys, sad sulfa. Shelley Cox just had to ban her from the store because sad sulfa, she'll come back later. She's just always sad, and you can't have such a sad person in your party store. It's bad for business. You just can't do it. She's banned from the store for being a party pooper, and so if your patient has a known sulfa allergy, don't give them celecoxib. Don't do it. It's not gonna go well. She's banned from the store. Okay, next, before we get to my favorite part, this is Pro Soup. They're known for their miso soup. Misoprostol? Miso Pro Soup? Misoprostol. Now, misoprostol is not an NSAID, but it belongs in Northitis District because naturally all these people have stomach problems. Of course. So, misoprostol, the miso soup at Pro Soup, is famous for settling your stomach. Misoprostol, the mode of action is that it decreases gastric acid secretion, so it just makes sure that there's less acid, which has its own problems of indigestion and things like that because you need stomach acid, and it actually affects the absorption of a few different drugs, many drugs that rely on the acidity of the stomach. But once you get to misoprostol, it's not like Celebrex because it's a soup, not a party store. So how does it affect the stomach? Well, it decreases the acidity, not increases the GI mucosa. They have a 5-star review because my baby loved this soup so much I went into labor. It's also used to initiate labor in pregnant patients if they're late to the party, I guess. I don't know. It induces labor. What else was I going to say? Oh, it's not an NSAID. It's a soup, not a person. It's not an NSAID. However, it's given alongside NSAIDs because it decreases gastric distress, things like that. This is my favorite. This is Old Man Mel. That's it. It's just Old Man Mel. He has a pet ox, and he carries a camcorder because he's just an adorable old man. His name is Meloxicam. All you need to know about meloxicam is that it's an NSAID. For our exam, that's it. Old Man Mel is in Northitis District. And you know how you remember that he's in Northitis District? He plays Santa in November and December. And that's why Northitis District's pole is decorated like the North Pole poles. Thank you.